love them.
My girlfriend's son was over yesterday, and he had a pair of them, and he was kind of, I guess, he runs them.
Oh my God. I go to the gym in these guys and I just adore them. And these are like my second pair because I first bought like a purple and black pair.
Yeah.
And they were just so comfortable. I was like, once I saw they had pink and black, I had to get them.
They're supposed to actually work all these different muscles when you walk or run.
And balance and stuff.
Yeah. They just feel like you got a slipper on.
Yeah, I love them.
Let's see here. Let me look at your any health history problems here. Not really,
no.
huh?
No, I'm pretty healthy.
You had a lipo on what areas did you have?
I had a tummy tuck back in I want to say '05. Probably a little bit before then. But then once the swelling went down, I still had a little flap, so he redid it again. And then I had a thigh lift. I had my arms done, but I would have preferred the scar this way, but he gave it this way. And then I had flank removal here.
With lipo back there?
No, I had no lipo in the back.
Where areas did you actually have the lipo?
Just in my stomach.
Okay. And what areas were you thinking of having lipo in?
In my back.
In your back. Okay. Yeah, that's an unusual direction to put the line in, but so I guess people don't like the scar down their arm, most of them.
Yeah, but I still have
would have
like
got
this.
more improvement.
Yeah, right. Because it's like, I lost quite a bit of weight. I had gastric bypass in '94, and so I lost over 100 pounds. So I was like a Shar-Pei. I had just loose skin just everywhere.
You still got it. Yeah.
Yeah,
Well,
still,
yeah, I think he was worried about keloiding maybe. Because, the keloids, it's more common with black skin.
Right.
And it gets that ropey look. And the keloid, the direction of the cut has a lot to do with the keloid.
Oh.
So when you run it, the natural skin grain, see that? See the difference?
Right.
See how it doesn't, so the natural grain runs that way.
Okay.
See?
Okay.
So when you run them with the grain, they're much less likely to keloid than if you go across grain.
Okay.
So he was probably afraid that you might get keloiding here. Of course, if you did, there are ways of treating it.
Okay.
With steroid injections into the scar tissue, or there's patches you can put on it, that medicated patches that go over it. I don't do that kind of surgery. It still might be worth the risk of the keloid, but I think that's probably the reason he didn't do it.
Yeah.
But because you could still go back to a surgeon and have it
redone,
and done, so that you don't have all this.
Yeah.
Anyway.
Yeah.
Right, but I bet that's why he didn't do it.
Yeah. Because when I look at it now, it's like an eyesore, and it's like, I don't like it.
Yeah, I'll give you the name on the way out.
Okay.
The guy who does those, you can talk to him about it.
Okay.
Let's see, stand up. Turn around. Let me see this back. So you're talking about like right up in here.
Yeah, in here.
And that's kind of your waist.
Yeah, that's my biggest nemesis. That right there.
What about this area?
No, that doesn't bother me as much.
Okay, there.
No, but it's all of this right here. These guys.
Well, we can treat that area. There are some limitations.
Okay.
The limitations being that there's still the issue with the skin. I can make it thinner and a little tighter because we use something called smart lipo. And smart lipo is a laser type of procedure that not only removes the fat, but it does cause some skin shrinking and tightening. Now, it does not tighten it as much as surgery.
Okay.
It wouldn't tighten it up enough to get that out, but it will be tighter, and it takes a few months for the full effect to take place as far as that goes. So
Okay.
I'm just saying, so it can certainly be improved, both in the tightening and also in the fat. But since there's so much loose skin back there, it's beyond full tightening. There'll still be some of the issues. It'll just be a lot better.
Okay.
I suppose looking at it, it'll be like 50% better. I mean, it'll be, but it won't be like perfect.
Right.
So
Right.
if that's acceptable, your back area, so is it, and that includes the operating room and the surgery. We're gonna give you a sedation here. This is a licensed surgery center.
Okay.
So, and I specialize in this. So you're in a good place for it. I mean, we're going to sedate you with a IV, not a general anesthetic, and we're going to fill that area with some anesthetic fluid as well. I'm going to treat the area with the laser and also remove the fat. And then you'll need a driver to take you home.
Okay.
And then you'll wear some kind of a support garment on it.
A compression garment.
Compression garment for like 3 weeks. There'll be a little soreness to it, but it's not anything really horrible. Not as bad as some of this other stuff you've had.
Yeah, I tell you, I've and see the thing is, I've been heavy all my life. I've never been skinny, so I don't know what skinny means. I don't even know how I would even look. I've never been it, and so, but after being so heavy, and then going in for the surgery and losing all that, and then after that, it was unsightly to have all of the loose skin, and then I got the thigh lift, so it was like, wow. So it's like now I'm just trying to, now that I'm 40, I want to, just kind of fix it up.
Okay. Okay, then you know what conscious sedation is.
Oh yeah.
Because we use Versed fentanyl, and that's our anesthesia that we use, along with the local. See, the fluid you put in there is a lidocaine epinephrine fluid.
Okay.
It goes into the fat to loosen it and keep it from having blood loss and anesthetize it, because the IV sedation is not quite enough. See.
Okay.
So. But you're still loopy from the sedation, so you need a driver to get home.
Okay.
If you didn't have a driver, there is an option of staying overnight for another night here, our little retreat, but it costs $300. Since you're a nurse, I'm going to give you a $500 discount on it.
Okay.
You won't object to that, will you?
No, no way.
And I think that's all you need to know. It's a pretty low risk deal. I mean, there's always a chance of an infection, but it's like 1 in 1,000 for lipo procedures. They're very unusual, or weird. Like you went through some serious surgeries, so the risk of bleeding or blood clots is almost nothing compared to what you had done. I mean, there's a little tiny chance of that, but not significant.
Okay.
And as far as bruising goes, there may be a little bit, but you're going to wear a garment on there for 3 weeks.
Right.
It'll go away before you're done with the garment. So, your work schedule? You work 5 days a week?
No, I'm pretty flexible.
Do you want to be done? You want to be done soon?
Yeah.
I've got an opening next week. Somebody canceled out on it. I'll give you that if you want to do it. We'll put you in there next week.
Now tell me, because I work out a lot, so would it affect my workouts and stuff?
If you, in an area like this where you're just doing one area, if you'll just take it easy for the day of the treatment and the day afterwards, you can do anything you want after that, and there will be no damage to what I did.
Okay.
Now, it may be that certain exercises may pull and tug at it and just be because it will be a little sore, So maybe there's certain exercises you won't want to do for a little while, but if you'll just give it 2 days, I'm sure you can find something to do at the gym and exercise, and certainly the bicycle, the walking, when you start stretching, and if you were trying to do jumping jacks or something, probably not, because of the pulling. But if you wanted to do some weights, I don't even think that's a problem. When you're leaning on the machine, like if you're doing a press, it might be sore on your back, but it won't damage it. So Yeah, I go to the gym a lot, so I'm sure you can find some stuff. You get in there on the treadmill or the Stairmaster or even a bike, you know,
No problem.
and be fine, and some limited other exercises that you're doing there.
Okay.
You'll be okay.
Okay.
All right, are you going to require financing options
Okay. No.
with that discount? So, I'll just send the girl in and let her get some more paperwork from you and get it all squared away.
Okay. Thank you.
All right.
Just a CBC.
Okay.
Yeah. Yeah, let me send it to you.
Okay.
Is that cool?
Okay, that's fine.
Yeah.
Okay.
And then when you come in, I just want you to bring the balance and then try your garment on
Okay.
ahead of time.
Okay.
And then the biggest thing, avoiding any aspirin 2 weeks before.
Okay.
Okay.
Alrighty. And tell me your name.
I'm Gina.
Tina, nice to meet you. And I will definitely confirm that with what day was that again?
The
The
5th.
5th?
Thursday the 5th.
Thursday the 5th. Okay. And then you'll let me know what time and all that
yes.
kind of stuff. Okay.
Absolutely.
Alrighty. No issues.
Alrighty.
Thank you so much.
Thank you. And then once you get your packet, if you have any questions, just give me a buzz.
Okay.
Yeah.
Alright.
Biggest thing is just the aspirin.
Okay.
And then the CBC, which you could just take that from the lab.
Okay.
Not letting you know. Oh yeah, definitely within the last year. It's been about maybe 6 months.
Oh, do you want to just give me a copy of it? And
I can
see
do
if-
that.
Yeah.
I can do it. Or I can take it another fresh one too, no problem.
Just give me a copy, we'll take a look at it in case
Okay.
it's what we need.
Okay.
And then, yeah, let's just touch base
Okay.
later today.
All right. Thank you.
Thanks, Tina.
You take care now.